you guys for joining today. Thank you guys for being on the call. If Just want to let folks know that we are starting the recording. If you are worried about being recorded and you don't want to be, feel free to leave the call. But definitely excited to be a part of this session today. Today we have an amazing opportunity to meet some amazing guests, and including our Dr. Quentin Cancel, which you'll hear from in a second. This is a part of a series of events that we're having. Again, my name is Alfred Ojukwu. I am the BAM HLS lead. We've done a number of sessions starting back in August and September of last year, where we've covered everything from vaccination awareness, as well as health equity. We've covered content around the medical divide and thinking about how we can provide better services for folks looking for that sort of for that journey. We've even went in and started speaking around accessibility in healthcare. So we've done a lot of work with trying to figure out where we can connect you and connect others on the discussion around your health. We've gone into mental health and spent a lot of time there last week. And this week, I'm also super excited because we continue that journey. We're talking about awareness and importance of health checkups. And you'll get an opportunity to hear from some amazing folks on what they're doing. Again, I want to just say a shout out and thank you to our crew here who have been helping to put these sessions together. Kimberly Gordon, Jamal Dance, Rasul Walls, Abele Okole, and myself. And really, if not for them, some of this would be very difficult to put together. We have session number 7 today, and I'm super excited to introduce to you our host and moderator, good friend of mine. He's definitely focused on the technology aspect of this scenario, and I want him to really kind of tell you guys who he is and what he does and why this is such a passion for him. So Edmond, it's on you. You're on mute though.
Thank you, Alfred. Thank you. My name is Edmond Washington. I'm a teams technical specialist in HLS. I'm based in Charlotte, North Carolina, but I feel connected to the New York BAMS crew since I grew up in Brooklyn, New York. I'm going to be your host and moderator for today's session, where we're going to discuss the importance of health checkups and cancer awareness. To help lead the discussion, we invited one of the top urologists in Western North Carolina, Dr. Quentin Cancel.
Go ahead and take over control. Control.
Yeah. All right. Sorry, the notes is not coming up. So Dr. Quentin Cancel is board certified urologist based in Western North Carolina. We brought him to the conversation today to kind of help lead this discussion. And so, Dr. Quentin Cancel, if you can turn on your camera, and we'll go ahead and start the conversation.
Well, thank you, Edmond, for having me here and inviting me here. Very excited to be able to be with you guys today and have a conversation about cancer screening. It's very important. I think having these conversations, particularly among us, is extremely important, just because the fact that we are far less likely to seek medical help and get screened. And oftentimes when we do get help, it's kind of when the disease is in an advanced state, unfortunately. So just a little bit about me. I am in Asheville, North Carolina. I've been here for about 3 years. Enjoy the mountains here. I was in private practice for over 12 years in Tennessee. And before then, I was at Duke, where I got my medical degree and did my residency there. And this is a passion of mine, just to promote health awareness among the African-American community. So thank you for having me.
Absolutely. Definitely appreciate the introduction. So I want to start with the first question. What is the importance of regular health checkups, and what do you typically see, on an everyday basis as a urologist?
Well, as a urologist, I'll just put it in terms of the biggest cancer that we deal with is prostate cancer. And just some statistics on prostate cancer. It is probably second only to lung cancer in a number of deaths in this country. There will be about 250,000 men diagnosed this year with prostate cancer, and over 35,000 men will die from prostate cancer. They say 1 in 8 men will develop prostate cancer in their lifetime. 1 in 7 African American men. So it's very prominent in the community, and unfortunately, we are less likely to be screened. The statistics bear this out, that African American men are less likely to be screened for prostate cancer, and we have the highest rate of prostate cancer in the world. We are 2.2 times more likely to have prostate cancer and die from prostate cancer than our white counterparts here. So it's so important for us to even know about this and why it's important to be screened. Oftentimes, screening is a preventative measure. Cancer, many times, does not actually come with symptoms until it becomes advanced. And so a lot of people think, oh, well, I should feel something if I have prostate cancer. No, you won't. That's the whole part of screening. And so when you get to the point where you start having symptoms, that's usually when the cancer is more advanced, harder and harder to treat. And so you don't want to get to that point. And so it's very important to catch it early, because when you screen early, you can catch things early and you can treat it early, and you have a better chance of cure if you do that. And so for prostate cancer specifically, and I know we'll talk about colon cancer as well, but there are 2 tests that you need for screening. And one is a blood test called the PSA, and that stands for prostate specific antigen. And that's a protein that is produced by your prostate gland specifically. And if it's elevated, it could indicate that you have prostate cancer. Now, it's not a tumor marker, so it's not specific for cancer. So for instance, if you have an infection of your prostate, your PSA could go up, or if you had some trauma to your perineum or your prostate, that could go up as well. So that's part of it, the blood test. And then the second half is the rectal exam. And a lot of people are hesitant to have that exam, but it really, you can't have one without the other. Some people, I know a lot of patients try to get away with just the blood test alone. But there are oftentimes the blood test is considered normal. It doesn't seem to be an outlier, but the rectal exam will pick up the cancer. And what we're looking for is a bump, a lump, or something unusual, a hard place on the prostate that can indicate prostate cancer. So it's just very important for us as Black men. And there's another statistic too that is just shocking, that even after we're diagnosed with prostate cancer, we are 6 times less likely to be given an option for treatment. And even in the screening process, we're less likely to be offered PSA screening by doctors. And so that just underscores the fact that there is racial bias in medicine, and it's incumbent upon us to be empowered with the information to know how to really take charge of our own health.
Why are the percentages so high among African American men for prostate cancer?
Oh man, there have been a lot of studies on this as to why, but when you consider the military, where access to healthcare is equal pretty much, those numbers come together more. But there are these social determinants of health that we talk about often that play a role in our access to healthcare. I think we don't have enough conversations as men about our health and the importance of getting checked. And so I think, there's a fear of going to the doctor. It's not just Black men. I treat all men, and it's kind of universal as men. We just don't like going to see the doctor. We'll wait till the wheels fall off before we go, or doesn't get up before we go to the doctor. And so oftentimes, it's the women in our lives that encourage us or come with us to get checked out. So there are a lot of factors that go into it. It's a man thing, but it's also historic with distrust of the medical profession. And we just don't see a lot of people like us that look like us on the other side. So there's a comfort level that we don't have.
Right.
Yes.
Absolutely. I got another question, and thank you, Elaine, for the question on why the percentages are so high among African American men. I got another question from Matt Davis. At what age should we seek a blood test?
Sure. Great question. The official answer from the AUA guidelines is that you should start getting screened at age 55. But for men who have a first-degree relative, meaning a brother or a father who has prostate cancer, or if you're African American, I recommend that you start at age 40. And that's, get your first blood test then. If it's greater than 2.5, then I would get that further investigated.
Absolutely. We got a question from one of our participants, Mike Williams. Can you come off mute and ask your question?
I'm trying.
You're still on mute. I can hear you.
Can you hear me now, Doc?
Mm-hmm.
Question.
Yes.
So one of the things I learned about prostate, and this is regular, and it's a two-part question. So the first part, how quickly it can happen. So I did a PSA full blood work in May, then went back in September and found out my original prostate was at a 3 PSA. My PSA was at a 3, but then I went back in September, it was at a 9. So I found out I had prostate cancer in September, 3 or 4 months later. And so did robotic surgery, got it all. What is the risk of it coming back? It's been 2 years now. Is there a bigger risk coming back?
Sure. Well, it really depends at what stage it was when it was treated. And you're a prime example. I don't know how old you are, but you look young. And that initial PSA that you had was probably too high at 3. You hear these numbers, and primary care physicians will throw these numbers out like, if it's below 4, it's okay, but that's not true. And PSA velocity is something that we look at as urologists, how fast it goes up over time. Yours tripled in a short amount of time, which, obviously was the indicator that you had a more aggressive disease. So it really depends. When you have surgery, and the thing I like about surgery is that you know what your margins are. And so your doctor was able to tell you with quite certainty whether or not he got it all. And that matters as far as your question is concerned. When should you worry about recurrence? So when your prostate cancer is contained and your prostate is removed and your margins are negative, then the likelihood of you having a recurrence is very low. If you have higher grade disease, and we can get into what that means, but if you have higher grade disease, then your chances of recurrence are a little higher. But if it's contained and you caught it early, then your chances are very low. Basically, in the first 2 to 3 years, if it's going to come back, that's the time frame that it's going to come back in, and that's why we check you every 3 months, typically, for those first 2 years with the PSA. Because if your PSA is undetectable, that means the cancer is still gone. But the moment you see a little PSA after surgery, that's an indication that it has recurred. And so you need to seek treatment after that. But the first 2 to 3 years is sort of that window that we're most concerned about it coming back. If you get past that, it's far less likely.
Thank you.
You're welcome.
Any more questions? All right.
I didn't think we were going to get these many questions this early.
Yeah, it's an important
Good.
topic. You know, which kind of leads me, and I know when you went to medical school, you probably had no idea what you was going to practice. So I wanted to know what motivated you to get into the field of medicine, and why did you choose urology?
Sure. I was interested in science. I've always been interested in science. And I think it's probably when I was in high school, my godfather, who's a urologist out in Riverside, I used to spend summers with him because his son is one of my best friends. And I observed, I saw he was living. They had a nice house and a couple nice cars, and he just seemed like he wasn't stressed, and he was around for his family, and just said, wow, like, I think I could do that, that this is nice. I want to live like this, and help people and be around for my family. So I got exposed early to urology. But it wasn't until I had a unfortunate experience in the hospital as a patient myself that the decision to go into medicine was solidified. When I was around, I don't know, 15 or so, I had spinal meningitis-like symptoms, and went to a teaching hospital where in St. Louis, where I got a spinal tap. And obviously someone was teaching a resident or someone, and I was scared to death. And I just felt like I was a guinea pig, and there was just no compassion. I thought I was going to get paralyzed. They stuck this needle in my back, and I'm sweating, and it was just screaming. It was awful. And they told me afterwards they had to come back and do it a second time because they didn't get enough the first time. And it was just a traumatic experience. And I just remember thinking to myself, I will never treat a patient like this, and I will have more compassion than this. And so that sort of solidified it for me.
Right. No, absolutely. That's an amazing story. I do have another question that's coming from one of our participants, Ms. Curry. You come off mute.
Hi, thank you. Oh, can you hear me?
Yep.
Great. Thank you so much for being here and sharing your stories and those alarming stats. So I work for Microsoft Advertising, and my team partners with large pharma companies, think of Pfizer's of the world, Johnson & Johnson, et cetera. And they leverage advertising as a way to educate patients as well as healthcare providers. So my question is, how can we continue to influence those companies so that they're educating both healthcare practitioners and patients as screening as a preventative way to improve these alarming statistics? Would love to hear your point of view.
Well, I mean, companies oftentimes, or anyone for that matter, it's always what's in it for me. What do I get out of it? And obviously, as a company, you want to have productive employees, and so to stress preventative care, preventative maintenance, screening is going to just make your employee population healthier and prevent some long-term issues for them. Oftentimes companies just don't do things because they're altruistic, unfortunately, but some do. And so, this is an area where I feel like there can be a lot of progress when you consider the historical context of how African Americans in this country have been treated by the government, or just in general with medicine in general. There is racism in healthcare, and there needs to be a recognition too of unconscious bias in medicine. And there's a reason why we're not offered even getting screened by providers, or why we're not offered getting treated at the same levels. And so, one area maybe just be, unconscious bias training, and just to understand, that everyone needs to be treated equally. You need to offer the African American that walks in your office a PSA test just like you would the white gentleman, or treatment. And so, just awareness of that, I think, is helpful, but also just in the community, if there's anything that you can do. I just don't feel like there's enough out there in our community that promotes these kind of conversations. I often joke with somebody that if the baby, or some famous person started talking about prostate cancer, like everybody would be getting screened, or just so whatever we can do to have these conversations in the open, and to talk about and promote that, and get that out in the environment, I think is a plus.
Yeah, no, I definitely agree. That kind of moved into like this question and some of the challenges that you see in your practice that pertain to prostate cancer. What are some of the additional challenges that you see on an everyday basis?
In diagnosing it, or the treatment, or after the treatment?
Yeah, diagnosing it, from the diagnosis perspective, yes.
Well, just the hesitancy of people feeling like I feel okay, therefore I am okay, and I don't need to get checked because I don't feel sick. So that's one. The other is, I alluded to before, is I can do half um, of the screening. The blood test is good enough. Um, you know, they asked me, Doc, is there any other way you can get around this rectal exam? And I said, no. This is not, God didn't make a window back there that we could just kind of just see it. We have to be able to touch it and make sure that that it's okay. And so getting over that, you have to. You have to get over that, and there are historic phobias that we've had as a community regarding things of that nature. Colon cancer is another one. That we'll talk about as well today. That's similar. There's a similar fear of I don't want anybody going back there. I don't want to. That's off limits, and we just have to get rid of that notion as men, that somehow that makes you vulnerable or less than a man, or whatever it is that you're feeling. I call it the Grown Man Checkup. If you're a grown man, you need to get checked, and that's part of it. So that again, just having that conversation, I think we as men can help our fellow man, our partners, to say, hey man, I lead by example. I got checked. Did you get checked? It's not a big deal.
Right.
And so particularly if you have a woman in your life, that's good to for the guys to step up and help each other.
Yeah, you're right. My mother sends my dad to the doctor anytime he sneezes, so it's definitely important to have a good partner. It was kind of leads us to the other question, and this will also give us opportunity to bring Mr. Joe Green in. But you mentioned colon cancer. What are some other additional screenings that are important, in particular for African American males?
Well, I mean, we're kind of, I mean, there's all sorts of health screenings for diabetes and hypertension. Hypertension is a silent killer, and it creeps up on you as you get older. You may not have a family history of it, but it will, when you hit 40, you probably should start getting checked too for that. But colon cancer, I have a couple of personal stories about colon cancer that are hit close to home and are a little scary. But when I was at Duke, we had a classmate who was diagnosed at the age of 33 with metastatic colon cancer. That means the cancer had spread beyond the colon at age 33. And he had a blog at the time. And he basically said, I ignored blood on my tissue when I wiped. I ignored it. I thought, and these are his words, I'm not gay. I shouldn't have anything going on back there, and he just ignored it. And he was a white guy, but he was diagnosed in January of that year, and he died in December of that same year, and had a 2-year-old son. And so that he encouraged all of us to get screened. If you notice any blood on the toilet paper, get screened. And so all of us did. Fortunately, everything came out okay. Last year, my father passed from colorectal cancer. He was 75 when he was diagnosed. And so it gave me pause again, and I went to get screened again. Fortunately, everything was okay. But that's just a couple of instances, and I had the fortune of meeting our next guest speaker through your parents, actually, treating them for prostate cancer. And he told me about him and that he is a colon cancer survivor. And I just thought that was remarkable, and he's got a remarkable story. So, it's probably a good time to bring him in to talk about his journey.
Absolutely, Joe. You can turn on your camera, but I'm gonna introduce you. Joe is a 41-year-old father of 2 beautiful children, 10 and 7. In April 2021, at the age of 40, he was diagnosed with stage 3 colon cancer. He underwent emergency surgery and completed 6 months of chemotherapy, was ended November 11, 2021. The completion of his treatment did not end there. I'm going to allow you to jump in, Joe, and tell your story and some of the good work that you're doing through your foundation.
Hey, appreciate y'all. Thank y'all for having me today. Again, my name is Joe Green. I'm a colon cancer survivor. I went last year. I turned 40 last year, and I went. It was always something told to me that when you hit the age of 40 as a black man, you need to go get your colonoscopy test done. And the same thing Dr. Q was saying. Earlier was basically like as men, we don't want to be touched back there in that area, but I had signs too, like, I had signs from like not being able to use the restroom and then seeing the blood on the inside the toilet and stuff like that. But again, like as a man, like you say, like you might say, like, well, I'm all right, I'm gonna be all right. But something told me that I need to get checked, and then long story just be short, I had to find a way because I don't have insurance. So I had to find a way to actually get it paid for. So if you're insured, they will pay for it at the age of 50 for your colonoscopy test done. But they changed the numbers last year when they changed the numbers the last 2 years after Chad Bosworth died, the Black Panther died from the disease. They took it down to 45. And then for me, I'm actually the ambassador of getting it changed to the age of 40. Taking the numbers down a little more lower, because if I had took that route and went on a route and waited till I was 45, I wouldn't have made it to see that. So I went, like I said, I went and had my test done. I went and had my colonoscopy test done, and woke up to the doctor telling me that, I have colon cancer. And my first question from him was like, first thing I said to him was, damn, of course. Then my next question to him was, well, doc, what's my next move? Like, I got kids, you know what I'm saying? So he said, well, I'm referring you to my specialist. So April 17th last year, 2021, I was diagnosed. April the 20th, I'm going to see the specialist. Specialist tells me, he's 45. He said, well, Joe, you don't eat red meat, you don't smoke, which is the number 1 triggers of the colon cancer. He said, well, I'm gonna get it out your body and we go on the back end from there. So I said, cool, let's do it. So April 17th, I got diagnosed. April 20th, I went to see the specialist. April 27th, I have emergency surgery. So I go have emergency surgery, and they take the mass of a tennis ball out of me, and let me know that I was actually stage 3 in the process. Now it's only 4 stages, and I ended up being stage 3. So like, if I'd have waited any longer, who knows? Who knows? Well, something definitely would came good out of that. So from there, I was put into chemo treatment. For I had 12 treatments. I had 12 treatments of chemo, and like Edmond said, I rang the bell November 11th of last year. And now, actually, I'm just going through like the after effects of chemo now. So like, my thing is to now basically like this to put out here, like it's called ESSL. It's basically a campaign that I created, and it's early screening saves lives. Because if I can advertise or put it out here in the world for somebody, a black man, especially a young black man, like somebody in my area or somebody younger or whatever, for somebody to go get screened or go get tested, that's what I'm doing. So like early screening saves lives. And I'm putting out there, I'm like, is this a story? This ain't coming from somebody that heard about it, nothing like that. And I'm actually living it. I'm going through it now. I'm going through the after effects of chemo. The after effects, like actually, to be honest with you, I just went to the doctor. I just left the doctor about an hour ago, and I ain't even told none of my family yet. But actually, my cancer came back. So, yeah. So,
Hear that.
Yeah. So, guys, one of the things I kind of left out is that Joe is my my brother-in-law, right? So I mean, it definitely it's tough. It impacts the entire family. I know, Joe. I wanted to. One of the questions I have for you is, what are some of the changes that you've done to kind of fight this battle? I know one of the biggest things we don't talk about is food, right? And so I know you completely changed your diet. Can you add to that?
yeah. So, the day after I got diagnosed, I reached out to a good friend of mine who actually went through colon cancer. Like he fought the battle a couple years before, and actually he didn't smoke or drink or do anything like that. So he sent me these videos of different things, especially about the foods that we put in our bodies. So like just looking at the videos, seeing how they the antibiotics they put in the chicken, the fish, and how they pump it, how they putting all the stuff into all the food, like it's actually going in our bodies and it's actually killing us from the inside too. Like, you know what I'm saying? Because it's just finding the diseases that's not the diseases, but this is finding the diseases that's in our bodies and eating at them more, like because the antibiotics that they putting in the food. So I chose to go plant based from that area, and I've been plant based for a year plus now, ever since. So I don't eat fish, I don't eat chicken, vegetables, fruit, and it's been a life changing. It's been a life changing experience, but it's definitely been for the best in my world, because like this makes this to lighten everything up a little bit. Like say if I use the restroom and like you walk by, you might not know I'm in the bathroom, to be honest with you. But like somebody that eat meat and eat chicken and stuff like that, how it's stuck in their body and stuff like that, you walk by the bathroom, you might be like, damn, like, cause like, it might hit you out the blue, like the smell, we might be like last time we laugh at it, but it's something that's living inside of us. And like that, it's that meat and it's all that stuff that's living inside of us. So I decided that day, after they took that mass out of me and took all of it out of me, I wasn't gonna put it back in my body. So that's what.
Can I just jump in here? And I'm sorry to hear that, Joe, about that, but I know you are a fighter and you will overcome this for sure. But the importance of healthy eating, healthy lifestyle, in combating not just cancer, but a lot of preventable diseases. Someone asked earlier, why does prostate cancer hit harder in Black men? Why do most disease states hit harder in Black men? And I'm sure you guys have talked about epigenetics or the stress factor that occurs, but it's real. You know, as Black men, we face a lot of stressors. Just being a Black man in America, that a lot of people don't deal with. And thinking of me just as a Black physician, just the desire, the need to feel like I need to help my fellow Black brothers. My white counterparts aren't doing this. They don't have that extra burden or that extra call that they feel. And so it permeates through all of our lives. And so how we deal with stress, how we deal with mental health, how we deal with our physical health, all of that matters. And how we treat disease, how we get over disease, how we actually get diseases. So it really all matters. So I'm glad you mentioned the part about your eating healthy, because that's certainly one factor.
Yeah, absolutely. So, doctor, I know we talked about the social determinants of health, and I myself have had negative experience with healthcare providers. I've seen my wife get treated unfairly, which was scary, seeing her actually kind of go through that. And obviously, we have the education, we have the salary, but still we were treated, no differently. And so I wanted to kind of ask you, what can we do as a community on our side to help bridge that gap of health equities?
Well, I don't know. I think there's two parts to that. I feel like we have to take responsibility for ourselves, and that means arming ourselves with education and awareness of our bodies and what we need to do to keep them healthy. And so you can't solely rely on the healthcare profession to do everything. So there's a part that we do play in this. On the other side, I have a problem with asking the victims how to not still be victimized. And I think the question is better posed to those that are in positions of power, and a lot of them are in my profession. How can we better police ourselves so that we are treating people fairly and with compassion, and have that cultural just competence in dealing with people that don't look like us, and understanding their worlds a little bit better. So I'm not sure I know one end that we can do ourselves, but the other end I think has to be done on the other side.
Absolutely. I mean, I think that kind of segue to a good question of what can Microsoft do, as a company, to kind of help you in this fight. And Joe, I think this would be a good opportunity as well to chime in on what help do you need, from us.
Yeah, again, ESSL, early screening saves lives. I really want to push that out to the world. I want to push that out, like, coming from a Black man's perspective, coming from a Black man's experience, coming from a Black man's knowledge. Like, I just want to push it out to the world. Like, and I need this. I need a platform. I need some help. You know what I'm saying? I want to build a podcast from it. I want to build a website from it. I want to write a book. I've been working on a book. There's everything I can to put the word out there, and to speak at engagements, and anything I can do to get this word out here. Just to save people from having to go through, hopefully to save them from having to go through what I've been through, man. And like, not saying it's just me. There's a lot of people in this world fighting this battle in different ways. So I met a lot of different people, experienced a lot of different things, and definitely if I can put my word out there, put my experience out there to save the next person from going through what I've been through, that's all that's what I'm definitely trying to do.
So thank you, Joe.
Excellent. Do you have a foundation too, or are you an organization, Joe?
So again, like, everything I got Joe. It's called Joe Green Foundation, but everything that I got, it's all new because this is new to me too. It's just like I just got, I just went through this experience, so I wasn't paying attention to health and all the stuff like this before it happened to me. Just being honest, but like all the stuff that I created now is like it's created, but cancer and going through these cancer treatments and all the stuff like that put you in a financial like it take you down to a financial wave that I didn't expect in life to hit me like that, but it hit me, you know what I'm saying? And it definitely I can't do the things like I used to could do in the fields I used to do. So like yes, I just need I'm just if I can find some kind of backing, some kind of support just to help me get these platforms off the ground and established and then put out there.
Absolutely.
I think let me just pause right here and just commend Joe just for wanting to be an ambassador for colon cancer awareness. You don't have to do any of this stuff. You could just kind of be to yourself and do your treatments and take care of your family, but you want to help other people, and I commend you for that. It's not an easy journey. I witnessed while you were getting chemo and you were still plugging and still promoting shows and awareness at your comedy shows, so man, my hat goes off to you. We need more people like you, and whatever we can do to support your efforts, we need to do. So I appreciate you.
Absolutely. Early screening saves lives. ESSL, so important. Thank you for sharing, Joe. For those that are here in this session, please take a moment to type the letter Y if you know someone that has gone through this situation or dealt with colon or prostate cancer. And at this time, we're going to open it up for questions for Q&A. Any questions out there?
Hi, my name is Mike Baker. I have a question. I know it's going to sound odd, but with COVID and everything that happened with the shutdown of the gyms and people not being able to work out the way we normally worked out, I experienced a 6-month period where I wasn't as active, and then I got a lump in my right armpit. When I noticed it was because I started running and I started trying to get back in shape. I did reach out to a doctor. My physician told me not to be concerned about it, that it was just probably, how you put it, he said it was probably stress related or something like that. He gave me a lot of different things to try. Eventually it went away. I mean, it took me a 3-4 month period, but it did go back down. But ever since then, now I'm kind of worried that maybe it was a first sign of possible cancer or something like that. So I have my yearly screening I'm going to go to here next month, and I'm just trying to make sure, should I, bring it back up? Should I mean, I don't know how to handle the conversation because I don't want to come off as an alarmist or anything, but you do get kind of scared when something happens to your body and you don't know why it's happening. Does that make sense? Right? And I know as we've been talking about cancer in various parts of the body, the common parts, prostate cancer, colon cancer. What about other parts of the body? I mean, are we, how can I phrase it? Should I be concerned that it could be another form of cancer? I don't know if that's the right question to ask, but
Yeah, I mean, many times, so if you have a swollen lymph node anywhere, it's sort of a reactive situation, usually reacting to an infection of some sort. If it's malignant, it typically does not go away.
Okay, so the node will stay hard or
exactly, it'll be hard, and it won't resolve. So yeah, so you're probably in good shape that it got better.
Okay, but then I need to keep a watch out in the future for hardening, right? Or I keep doing the whole touch test thing they say do, but I haven't felt anything return at this point.
Yeah, no, just keep an eye on things. Listen to your body when stuff starts happening. I tell people, like, if you see blood in your urine, that's never normal. If you see blood when you wipe, that's not normal. If you cough up blood, that's not normal. So these are all potential signs of cancer. And so we can't ignore things when we see them. And I would say this, because there is bias in medicine, if you are unsatisfied with the care that you're getting, or the answers that you're getting, you don't feel like you're getting answers, don't feel like you have to stick with the same provider. Get a second.
And I think that's the thing, is that when I approached the doctor with it, it wasn't that he belittled it. It just didn't seem like it was fully understood. I kind of left with a half felt, notion that maybe it could be more. And I kept going over and over and over. And I never got the sense that, I don't know, I didn't know how to put it to bed properly, but that's why I brought it up. But
what's the superstar thingy coming from?
I don't know what that was.
Somebody is on mute.
My microphone is off.
Yeah.
But I appreciate it. Thank you.
Yes.
Appreciate that question. Cheryl, so you have your hand raised.
Yes, I just wanted to thank you and Bam for putting this together. Joe, your courage is tremendous, and Edmond, you as well. I wanted to speak to just the value of the support system. Getting a diagnosis is really scary. And a lot of times people feel like, well, now I know I can move forward, but sometimes moving forward, you're paralyzed. My cousin had a colonoscopy where they actually found something and he needed to have surgery, and he was just paralyzed with fear. And it went to the point where he didn't seek out treatment, and doctors were contacting him and asking him to come back. And that's kind of unusual as well, because sometimes they give you a couple of calls and they'll just say, call me when you're ready. But the urgency around it, and the stress and toll that it took on the family, because he even masked it to say that he had food poisoning. He was starting to lose weight and he wasn't looking as healthy. He was telling people that he had the flu. He was in an excruciating amount of pain. And he doesn't live, I live in California, he lives in Texas, and he reached out to me and he's like, cousin, I think I want to come out there. Like, I'm not feeling good. And he told me about the results that he got back. And I said, how long ago was that? And he said, it was like 3 or 4 months ago. And I'm like, come on now, you gotta make some moves. Like, you can't, it's not gonna go away. But
I think you're on mute again.
one of the things he shared with me from the South was, when you get cut open, it spreads everywhere. So I don't want them to cut me and I was like, what? But that's what he believed. And the rally that it took to try to get him in to get treatment, he finally just ended up collapsing at home, and he was rushed to the hospital, and he had stage 4 cancer. It had spread, and he was just under pain management. And unfortunately, because he didn't disclose it, and I wasn't aware because I didn't live in the state, none of the family knew that he had it. So the significance and importance of the support and reaching out, even when you're scared, is so important. We lost him, but the devastation and the mixed emotions of the fact that no one knew that he was struggling and how scared he was, getting that information is really just the first step. And it really shows, and I value the relationship that I see between the two of you, because having that support, having someone by your side is so important. I mean, I wish he had reached out earlier, but I saw that how paralyzing getting that news can be. So support is so important.
Yeah, definitely.
Wow.
Yeah. I got that information in real time. So I felt like I got just hit in the stomach during this call. So yeah, family support is definitely important. And so, we're going to do everything we can to support, my brother and anybody else on this call that's going through that with a family member. And certainly, I definitely feel for you. The next question is coming from Ibeli. I see you got your hand up.
All right. Well, actually, I was going to ask a question about the type of screening we should be asking for when we go in and see our doctor beyond just what's, traditional screening. But I almost want to pivot a little bit back to what the last person was talking about and how we marry up new diagnoses or even, the treatment experience with mental health services, because a new diagnosis comes with a lot of challenges for individuals. And I kind of want to see what resources are available to individuals as they navigate their healthcare, or what there should be if there's nothing yet, how we can innovate around that as well.
This is a really, really good point, because some people, just the processing of this mentally is very difficult and is a challenge, and it's traumatic.
Mm-hmm.
And I don't think we have that type of support system right now on initial diagnosis.
Mm-hmm.
For things like, we don't have that, that hotline you can call right away. Now, there are prostate cancer support groups. I'm sure, just like there are cancer support groups everywhere, they're usually filled with people that have already, been diagnosed and have been treated. But that initial hit that you get when you get punched in the gut, knowing that you have, the big C word, I'm thinking about it. I don't think I've ever steered a patient for any type of mental health resource for that, and that's something that you should change, actually.
I appreciate it. Thank you.
Thank you, Belly. We have time for one more question, Kimberly, and this is actually something I want to know. Kimberly, if you could unmute.
Oh, hi. Yes. So I would like to know, is chemo the only way and best way to combat cancer? I feel like chemo is like we're directed to chemo right away. I've had a couple of, actually 2 people in my family who were diagnosed with cancer. And the doctors immediately said, we're going to go down the chemotherapy route. Now, for one of my aunts, she said no. She's like, I don't feel that. I've done all of the research. I've talked to other doctors. I want to go down the radiation therapy route first. And let's see how that works out. And long story short, she did that, and she's cancer free. She's fine. But I just want to know, from a chemo perspective, because of the side effects and because of the things that happen to your body, and everybody's different, right? And from a side effects perspective, are there other therapies that work best for this type of cancer, for prostate cancer? I mean, there's so much stuff out there. I just want to understand.
I'll try to answer this quickly. It really depends on the stage which you're diagnosed. For prostate cancer, if it's caught early, there's no chemo, there's no radiation needed if you do surgery. When cancer is in its more advanced stages, I'd say stage 3, stage 4, that's when you're looking at chemo. Not all cancers are the same. And so it really is a conversation to have. And it's a collaborative conversation you should have with your doctor.
Yeah.
And understand why they're recommending this, and come up with a treatment plan that you feel good about, knowing all the options.
Yeah. Thank you for that.
We got about a minute left. Joe, Dr. Cancel, any last words you want to leave us with?
My thing is to say, no matter how you feel on the outside, you don't know what's going on the inside. So go out there and get checked. You know what I'm saying? Don't ignore the signs. Like, put your pride to the side for a minute. If you got family, you got something to live for. Like, again, ESSL, early screening saves lives.
Thank you, Joe.
Yeah, and I would piggyback on that and also say Black health equals Black wealth. And if you're sick and you can't work, you can't be productive, you can't support your family. So for men, that's the take home. We got to take care of ourselves. We have to be proactive and just take charge and be men and stand up as men and do what we need to do to be around for our families and for our community.
Thank you. I appreciate that. Alfred, I'm going to pass it back to you.
Dude, amazing content. Thank you, Dr. Cancel. Thank you, Joe. Thank you, Edmond. I think, just want to give a round of applause, everyone, for our guest here. It's amazing content. And I think the hearts are really you're pulling our heartstrings, Joe, man. You really are, man. But we know it's for the better. We appreciate everything you've had to share. Hopefully we'll be able to continue these discussions, maybe have you guys come back in the near future. And for everyone that joined the call, thank you so much. The content was recorded. It will be available for you guys. We have our next session coming up on I believe the 26th at 12. So in about 2 weeks, 2.5 weeks, a session with Smile Therapy. They'll be focusing on Black mental health. So be prepared for that. But again, I just want to say, make sure you know the importance of healthy checkups and cancer awareness. This is what it's all about. And I appreciate all of you guys. Other than that, guys, have a great day and enjoy your rest of the day. Bye, guys.
Thank you. Bye-bye.